Medicare provides truly excellent coverage to millions of senior citizens and others across the United States. But do you qualify? Well, that's what we're going to go over in today's video. Now, we release these videos on a weekly basis, so please make sure to subscribe to stay up to date. And of course, to help us get this info out there, make sure to give us a like, click that thumbs up button. And of course, even though we do release these videos on a weekly basis, we recognize that many of our viewers and our clients still have questions. So if you have a question of any kind, you can reach us in the comments below. We'll be happy to answer your question to the best of our ability. And of course, you can reach us at the number on the screen, and there's no charge for our services. Now, most people take for granted that they will become eligible when they turn 65, but there are still many with questions, especially if you are eligible through a disability or other circumstances. Now, turning 65 is, of course, the big birthday. You'll be eligible for Medicare when you turn 65 if you're a U.S. citizen or you're over 65 and a permanent legal resident who's lived in the United States for at least 5 years. Now, as I said earlier, most people take for granted that they'll be eligible for Medicare when they turn 65. But what many people don't know is that there are premiums associated with Medicare. Usually Medicare Part B, but there can be a premium for Medicare Part A. Now, you will receive premium-free Medicare Part A if you are receiving Social Security benefits or railroad retirement benefits, or if you've worked long enough to receive Social Security benefits, so that would be 40 quarters or more. Now, of course, you're also eligible for premium-free Medicare Part A even if you don't work and have paid into Social Security, but your spouse has. So if your spouse has paid into Social Security and they have a Medicare-covered job, then you are still covered. And this also applies to government employees or retirees who have paid into Medicare payroll taxes as well. Now, I'll be honest, if you are not eligible for premium-free Medicare Part A, it can be pretty pricey. So in 2023, the premium for Medicare Part A can be up to $506. But if you've worked between 30 and 40 quarters, then it would be $278. And of course, once you hit that 40th quarter, then your premium would no longer apply. Now, many people, if not most, will be automatically enrolled in Medicare when they turn 65. So this initial enrollment period is the 7-month window surrounding your 65th birthday. So that is the 3 months before you turn 65, the month of your 65th birthday, and the 3 months thereafter. You should receive your Medicare card in the mail at this time. But if you do not, make sure you contact Social Security. Now, if you're under 65, you may still qualify for Medicare, but only under specific circumstances. So you can also qualify for Medicare based on a disability. Basically, if you are someone who is entitled to those Social Security benefits or railroad retirement benefits, as we mentioned earlier, and you are receiving those benefits based on your disability, after 24 months, you're entitled to Medicare Part A. And actually, those 24 months don't have to be consecutive. So if there's a break in the 24 months in which you are receiving those Social Security or railroad retirement benefits, then you would still be eligible for Part A after the 24th month. There are two special cases, though, that I want to discuss. The first is for people who have ALS. So if you are somebody who's been diagnosed with ALS, you're actually entitled to Medicare Part A the very first month that you're entitled to those Social Security or railroad retirement disability benefits. So there's no waiting period. You don't have to wait the 24 months that you would ordinarily have to wait otherwise. And also, if you qualify for Medicare based on end-stage renal disease, which is basically kidney failure, then you are eligible for Medicare Part A, specifically premium-free Medicare Part A, if you receive regular dialysis treatments or you've had a kidney transplant and you filed an application for Medicare. Now, you would have to have worked and paid into those Social Security taxes or had a job that offered railroad retirement benefits or worked as a government employee, unless, of course, you are the spouse or dependent child of a person who's worked the qualifying amount of time to receive those benefits. Now, if this is the case, again, you wouldn't have to wait that full 24 months. So it could begin the 3rd month after the month in which a regular course of dialysis begins, or the very first month a regular course of dialysis begins if you are engaged in self-dialysis training, or of course the first month of a kidney transplant, or even 2 months prior to the transplant if you had to be hospitalized during those months to prepare for the transplant. Now remember, Original Medicare is Part A, which is your hospital insurance, and Part B, which is your outpatient insurance. And although most people don't have a premium for Medicare Part A, there is pretty much always a premium associated with Medicare Part B. And it's actually determined by your income. So in 2023, the base Medicare Part B premium is $164.90 per person, but it can go up from there dependent upon your income. However, there are programs designed to help you pay for your Medicare benefits. Specifically, I'm talking about Medicare savings programs. So eligibility for these programs, and there's 4 different programs, are determined by your assets and your income. And the criteria is rather stringent, but if you are eligible for one of these programs, they can help to pay for your Part A, if needed, your Part B, and they can even offer you cost-saving benefits for Part D, which are those prescription drug plans. Now, when you are eligible, if you are eligible, you may need to make decisions about whether to actively enroll or actively defer. As I mentioned earlier, if you are somebody that is not automatically enrolled, then you need to contact Social Security. If you're someone who's automatically enrolled, but perhaps you don't wish to be, and you wish to defer Medicare Part B, then what you need to do is follow the instructions on the back of the card and send it back. Because if you keep the card, you will keep Medicare Part B, and you're going to be charged for it. Now, this only applies in very specific situations. Most often, this applies to people who are continuing to work past the age of 65 and are maintaining creditable coverage through their employer. So if you already have health insurance offered by your employer, then you don't need Medicare on top of that. Basically, you would be paying twice for absolutely no reason. But again, you do want to follow the instructions on the back of the card and send it back, and you want to make sure that you don't have a coverage lapse without creditable coverage. So when it's time to enroll again, make sure that you contact Social Security, because there is a Medicare Part B late penalty, and you definitely don't want to have that apply. And the Part B late penalty can be pretty hefty. Basically, you'll pay an extra 10% for each year that you could have signed up for Part B, but didn't. So that's an extra 10% of your monthly premium. So here's the example that they actually give on Medicare.gov. So let's say you waited 2 years or 24 months and you were able to sign up for Part B, but you didn't qualify for a special enrollment period, anything like that. So you would have to pay 10% for each full year. So that's 20% of your monthly premium on top of the monthly premium you'd usually pay. So in 2023, the monthly premium is going to be $164.90. That's the base monthly premium. And then 20% of that is $32.98. So you would have to pay that on top of your monthly premium every month. Because remember, this is not a one-time late fee. This is added to your monthly premiums forever. So you definitely want to avoid the Part B late penalty. And of course, that's just the base Medicare Part B premium. It could be more if you have a higher income. Now, the only exception to this is if you're maintaining creditable coverage. And since we're talking about late penalties, I do just want to also mention that there can be a late penalty for Part D as well, which is your prescription drug coverage. Again, if you have a coverage lapse, then you may be subject to a Part D late penalty. However, in all honesty, it is nowhere near as significant as your Part B late penalty. So of course, we recommend that you don't go without coverage, but if you have a very small coverage lapse for specifically Part D, it's probably not the end of the world. If you have any questions about your Medicare coverage, please feel free to send us a message in the comments or give us a call at the number on the screen. And if you need any type of assistance enrolling in any of the Medicare programs, so that would be if you're interested in Medicare Advantage, Medicare Part D, or a Medigap plan, also known as a Medicare Supplement plan, we can absolutely assist you with that as well. There's no charge for our services, and we are licensed nationwide. And please, before you go, don't forget to subscribe to stay up to date. There are constant updates and changes in the world of Medicare, so we want to make sure that our viewers are as informed as possible. And make sure to give this video a like. Click that thumbs up button before you head out. All right, thank you so much. Have a wonderful day. Bye-bye.